National Hispanic Council on Aging and the quality work we are doing across the country is all about. For more than 30 years, NHCOA has been at the forefront of U.S. Latino aging issues. And during 2014, the organization poised itself for greater growth and success through effective programs, research, events, communications, and advocacy that reached millions across the country. At the core of NHCOA's work is a growing network of local grassroots leaders who are providing targeted solutions to local problems that Hispanic older adults, their families, and caregivers are facing in their communities. In 2014, NHCOA continued with its Promoting Communities of Success regional meeting series in Florida, Texas, and California. We trained about 130 NHCOA leaders at our signature leadership program, the Empowerment and Civic Engagement Training. Following each leadership training, we also hosted more than 500 Hispanic older adults, family members, caregivers, advocates, professionals, members of the media, and government representatives at our community open forums. Connecting all key stakeholders who are invested in the well-being of our padres and abuelitos is not only crucial to our mission, but also necessary so that we can ensure that seniors, their families, and caregivers have access to the tools and resources they need to age in place with dignity and in the best health possible. It was an honor to have our board members join us for the Miami Open Forum in May 2014. Your collective presence and expertise strengthen our efforts and commitment to the Hispanic older adults, families, and caregivers we serve. Given the program's popularity, NHCOA also held 2 additional trainings in 2014, both in Los Angeles. Our leadership program will expand in 2015 with several invitations, including a collaboration with the University of Miami and another in California. In 2014, we worked hard to mobilize the community, collecting more than 5,000 signatures from seniors across the country that were presented to the offices of members of Congress during our Advocacy Day in November. Members of the NHCOA Leaders Network flew in from different parts of the country, petition in hand, to talk about the Older Americans Act reauthorization, as well as aging issues that impact Latino seniors across the country. Earlier that day, we released our signature Status of Hispanic Older Adults report at a Capitol Hill briefing. It is the only report that provides insight and recommendations that specifically pertain to the U.S. Latino senior population. The report also includes policy recommendations capturing the hardships and challenges Hispanic older adults face as a result from insufficient policies, programs, and strategies to address the aging and diversification of our U.S. population. We were honored to count with NHCOA board member Cindy Badilla's expertise and leadership as MC and moderator of a panel of experts and community leaders. AARP's Director of Federal Health and Family Advocacy also spoke briefly on the impact and importance of the Older Americans Act. Members of Congress in attendance reaffirmed their commitment to reauthorizing this important law, which hasn't been updated since 2011. The report was made possible thanks to the support of Lilly, CVS Health, AARP, Comcast, Pharma, Pfizer, WellPoint, and Verizon. NHCOA also advocated to expand funds for Medicare fraud prevention, which Hispanic older adults are much more vulnerable to compared to other peer populations. We made several Hill visits, as well as submitted a letter to HHS. Programs are an essential part of NHCOA's work. We disseminate and create culturally and linguistically appropriate tools and resources, as well as provide technical assistance and training to local community-based organizations that are part of NHCOA's Hispanic Aging Network to conduct outreach and education to the Hispanic older adults in their communities. In 2014, our programs addressed issues such as diabetes control and prevention, adult vaccinations, HIV prevention, and Medicare fraud prevention. which disproportionately affects our community. We also worked hard to educate Latinos about paid and sick leave policies. Some highlights from our health education programs include training more than 300 promotores across the country, reaching over 30,000 individuals through personalized charlas and community events, developing and disseminating innovative culturally, linguistically, and age-sensitive toolboxes that include videos, outreach materials, and webinars. In 2014, NHCOA played an active role helping low-income, hard-to-reach Hispanic older adults enroll in and navigate the healthcare system. As a national expert in reaching the hardest-to-reach segment of the Latino population, NHCOA successfully implemented the Exchange Navigator program in the Hispanic monolingual populations of Dallas County, Texas, and Miami-Dade County, Florida. Despite the challenging environment and circumstances, including low health literacy levels and no Medicare expansion in the states we were working in, we were able to establish local NHCOA offices in Dallas and Miami, train federal and state certified navigators in each site, educate over 70,000 individuals through community outreach and education, reach nearly 18 million impressions through communications activities, and facilitate the enrollment of nearly 20,000 individuals in both sites. Research is crucial to shaping NHCOA's public policy and programs, especially when it concerns underserved and underrepresented populations like U.S. Hispanic older adults. In 2014, we conducted a multiple sclerosis investigation, which adds to a growing list of innovative research that includes diabetes, Alzheimer's disease, and the effect of playing bingo on diabetes prevention and management. Spanish language radio and TV have been key to informing monolingual and bilingual Hispanic older adults, their families, and caregivers about NHCOA's work. In particular, it was amazing to see the conversion rate in the markets we were conducting ACA outreach and enrollment. Shortly after an interview or news package, phones would start immediately ringing, and dozens of people would show up at our offices for assistance. As we look forward, earned Spanish language TV and radio coverage are necessary and successful strategies to raise awareness about issues that impact Hispanic older adults, as well as cement our reputation as the leading national organization serving Latino seniors, their families, and caregivers. Social media has become increasingly central to the dissemination of NHCOA's program and policy work at the local and national level. Last year, the organization reached more than 7.3 million impressions through our Facebook and Twitter handles, participating in dozens of Twitter town halls and tweet-ups, as well as hundreds of thousands of interactions with partner organizations, professionals, and advocates. We are projected to at least double the number of social media impressions for 2015. As we look to the challenges and opportunities ahead, we look to your governance as a guidepost and a beacon of light, shining the way. We salute you and thank you for believing in our mission, sharing our vision, and helping us to achieve a stronger, golden America for all.